Exercise and sports psychology involves the study of human behavior in exercise and sport-related environments in both individual and group contexts.
Professional duties of exercise and sports psychologists. The first one is academic exercise and sports psychologist, a person that strives to expand and disseminate the knowledge based through teaching and critical research. Applied exercise sports psychologist applies the knowledge based in real-world situations. The third is clinical exercise sports psychologist, someone that specializes in helping athletes solve issues related to mental health, anxiety, and drug dependence. History of exercise and sports psychology. Exercise and sports psychology began around the 19th and 20th century. In the 1960s and 1970s saw the maturation of exercise and sports psychology. In the 1980s and 1990s saw the growth and development of the field. In 1983, the U.S. Olympic Committee established the official Sports Psychology Committee and registry with three categories: clinical, educational, and research sport psychology. In 1987, the American Psychological Association recognized the practice. Some notable historical figures in exercise and sport psychology. In 1884, Conrad Reiger published what is considered to be the first article on exercise and psychology. In 1897, Norman Triplett published the first experimental study in exercise psychology. Another notable historical figure is Coleman R. Griffin. In 1918, he was the first investigator to conduct systematic sports psychology research. There are two paired disciplines of exercise and sports psychology. One is physical education, which includes anatomy, biomechanics, exercise physiology, exercise testing, and motor learning. The other is psychology, which is the study of human behavior. One area of study is exercise psychology. It represents the merging of exercise science and psychology. One branch off of exercise psychology is exercise and mood state. It is highly researched and deals with acute and chronic mood states during exercise. Some mood states include tension, depression, anger, vigor, fatigue, and confusion. Other branches of exercise psychology are exercise adherence and exercise dependence syndrome. Another area of study is sports psychology. It addresses psychological characteristics and high-level performance, skill acquisition, group dynamics, motivation, overtraining, staleness, burnout, and psychological techniques for individual performance. A branch of sports psychology is personality in sport. Three theories that explain the relationship of personality and sport are trait theory, situational approach, and interactional approach. Other areas of sports psychology are overtraining, staleness, and burnout. Causes of burnout and staleness are too much stress and pressure, poor rest, and lack of sleep. Theoretical approaches include behavior, psychophysiological, and cognitive behavior. Research methodologies include qualitative research, using any of the five main traditions. Quantitative research is employing strict experimental control procedures to study the effect of manipulation of an independent variable on the dependent variable. Technology and research tools are used to observe data. Some electronic devices to observe data is heart rate monitor, pedometer, accelerometers, global positioning system, GPS, and software. Educational preparation of master programs addresses human movement, exercise adherence, and or psychological kinesiology. Another is the doctoral programs, which has 4 different tracks for exercise and sports psychology. Certifications include the AAASP and the USOC. Employment opportunities include higher education, primary and secondary education, fitness and wellness, rehabilitation, and consulting. At the end of the chapter, there are many professional associations, journals, and publications.